Hello everyone, a very good morning to all of you. So today let's talk about a very small topic called aplastic anemia. Okay, so in the previous video I talked about iron deficiency anemia. So today let's see what is aplastic anemia. So aplastic anemia, the basic defect lies in defective or failure of bone marrow. Why there is a bone marrow failure? Because there is a destruction of pluripotent hematopoietic stem cells. So what are all these? See, basically you look at bone marrow, that is the mother of all the cells, WBC, platelets and RBCs. So when there is some destruction happening in the hematopoietic stem cells that is not going to produce RBCs, WBC and the platelets, the bone marrow is going to fail. Okay, so what happens, there's going to be destruction of multipotent hematopoietic stem cells. So these cells, these multipotent hematopoietic stem cells, they give rise to what is called as RBC, WBCs and the platelets. So because there is a destruction, I'll tell you what are the causes where it is getting destroyed. Okay, so there is going to be decreased RBC, WBCs and the platelets. So there is going to result in, so because of these reduced production of these cells, that is going to result in bone marrow failure. Very simple, right? So when there is no hematopoietic stem cells, there is no RBC, WBC platelets, and the bone marrow is going to fail. Okay, now I'll tell you a few very important causes for this destruction of hematopoietic stem cells or bone marrow failure. Okay, so the first one would be immune mediated destruction. So immune mediated destruction, the cause remains unknown, idiopathic cause. Okay, so what happens in immune mediated destruction is there's going to be a release of cytotoxic T lymphocytes. Okay, cytotoxic T lymphocytes. So these cytotoxic T lymphocytes, they are going to release what is called as the pro-inflammatory cytokines. So pro-inflammatory cytokines like interleukin 1, 6, TNF alpha, interleukin 8. So all these, they are going to destroy the bone marrow and they induce apoptosis of these multipotent hematopoietic stem cells. Okay, so whenever there is an autoimmune disease, it triggers the cytotoxic T lymphocytes. So the pro-inflammatory cytokines are released. So there is a destruction of bone marrow and increased apoptosis of these cells, which in turn is going to result in destruction of or failure of bone marrow. So the second most important cause of aplastic anemia is it can be induced because of some external agents like drugs. Okay, drugs, radiotherapy. So drugs, chemotherapy. Okay, so because of these drugs, it is going to directly affect or permanently damage the DNA. Mitochondrial damage is going to take place. That is going to result in DNA damage and mitochondrial damage. That is going to result in destruction of hematopoietic stem cells. Okay, so the second will be drugs, chemotherapy, radiotherapy. Okay, so third can be post-viral infections or simply viral infections. So in viral infections, it can be either because of post hepatitis or some viruses like Epstein-Barr virus, parvovirus. Okay, so these viruses can also result in autoimmune destruction or can result in the damage of the hematopoietic stem cells. So basically, if you look at the main three reasons, these three contribute predominantly to the aplastic anemia. Okay, so now you are going to tell me how the blood picture or the investigations will look like. So investigations, what I'm going to do, I'm going to do CBC. So there's going to be decreased RBC, decreased WBC, decreased platelets. What is it called as? This triad is called as pancytopenia. Okay, so I can see decreased RBC, decreased WBC, decreased platelets, and decreased reticulocyte count. What is reticulocyte? Reticulocytes are young RBCs. So of course, there is no production of RBCs. Obviously, the young RBCs will also get reduced. So there is going to be decreased reticulocyte count. So bone marrow aspiration. Bone marrow aspiration, if you see, there is going to be decreased or hypocellular marrow. Why hypocellular? There is decreased cells because of the destruction of the hematopoietic stem cells. So there is going to be hypocellular marrow. Okay, so what are the investigations? CBC, I can see decreased RBC, WBC platelets, decreased reticulocyte count, and bone marrow, I can see hypocellular marrow. Okay, so what is the treatment for these patients? I should treat the underlying cause. Drugs, offending drugs, I should try to remove it. Supportive care like antibiotic prophylaxis, antifungals, and also platelet transfusions and immunosuppressive therapy like cyclosporine. Okay, so these will form the very basics of aplastic anemia. What happens in aplastic anemia, what is the underlying pathophysiology, and what is the investigations and the treatment you see in aplastic anemia. Aplastic anemia is also one of the most commonly asked concepts or topics in the NEET previous MDUs. So you understand these basics and try to add some more informations, advanced informations about aplastic anemia. So with this basics, you can add anything and you can correlate it. So thank you so much for watching the video. Have a nice day.